Good afternoon, everyone, and good morning for those of you joining us from Central Mountain Pacific time zones. This is being broadcast nationwide, I think, based on the attendance. I'm Paul Fahey, Vice President with Smith & Jones, Marketing Communications and Consultancy based in upstate New York, but obviously working with folks around the country. And thanks for joining us this afternoon or today for our webinar. Recruitment, and we're back a couple slides. That's my fault. Look at that, we're off to a good start. Thanks for joining us for healthcare recruitment and retention in the mass resignation age. Certainly this has been a challenge that our industry has been facing for decades. It's gotten a lot worse from the economy and from some other factors that you'll hear us talk about. And obviously this is something that we wanted to include in our trends report, and it's apparently very important to you, judging by the number of people that we have on various platforms. So welcome. This is being streamed on a number of different platforms. We're live here on Zoom, and a number of you joining us there. It's also being streamed to our Facebook feed, YouTube, and LinkedIn channels. So thank you to everybody joining us across all of those platforms. We'd love to try to make this as interactive as possible as we go today, so please put, for those of you on Zoom, please put questions in the Q&A or chat. And for those of you on social media, we'll be monitoring those and we'll try to relay those to the studio as we go through. If we don't have time for your questions, obviously we'll try to answer them offline or respond to comments. And this is being recorded. So for those of you watching this on demand in the future, this is being taped on November 4th, 2021. And I mention that because some of the policies and statistics that we'll talk about today are likely to change over time. So if you're viewing this on demand in the future, please keep that in mind as we go along. So before we begin, wanted to introduce the co-authors of our Trends Report this year, and this is the second webinar in that series, as many of you joined us in September for that launch, and as we're going over that, I just wanted to acknowledge some of the folks that helped put that together. So joining me live in the studio is Katie Source. Katie is a content strategist with Smith & Jones. She's been with us since 2018 and really held a lot of roles both on the client side as well as Smith & Jones, marketing strategy, project management, content development, and she is a proud graduate of Syracuse University's Newhouse School with her master's in communications and advertising. Thanks for being with us, Katie.
Yeah, thank you, Paul. And if you don't know Paul Fahey, he is also here in the studio with us. And he is the Vice President of Smith & Jones and has consulted with more than 70 hospitals and health systems over the years on everything from service line marketing to branding to employee recruitment and crisis PR. And we also wanted to shout out our colleague, Lisa Brown, who is out there in the office somewhere. She is our Chief Marketing and Content Officer, and she oversees our content and message development. And she's known internationally for creating best practices and strategies for content and social media marketing. And also wanted to shout out really quick our studio engineer. He's the manager of Over at Studios, Adam Claremont. You might hear us talking to him throughout this. And he is running our stream today. So thank you, Adam. We appreciate you. And now to get into the agenda, we're going to talk about how you can position your organization amongst all of these current struggles that are happening. How you can build an employee culture that is mission-aligned and patient-centric while still being attentive to the challenges facing your employees and the healthcare workers in general. And we'll discuss the impact of COVID and vaccination mandates on community and employee engagement, and we'll go through some tips and tactics. So now I'm going to throw it back to Paul.
Thanks, Katie. So yeah, as you can gather from the topic and the title of today's presentation, we're talking about healthcare recruitment, retention, chronic issue. It's been plaguing us for quite some time in this era, though, of mass resignation. And part of that, has to do with the COVID and the global economy and the impact of all industries, frankly. Also has a fair amount to do with recently some of the vaccination mandates that were being rolled out across the country. So I think it's important before we begin to let you know our point of view on this topic. We are pro-vaccination. We are pro-vaccination policy and mandates. We encourage all of our clients and colleagues that are rolling out these programs nationwide to stay the course. We believe, and you'll hear us describe this throughout today's presentation, your core job is patient care, and that's the foundation and bedrock of your brand. Everything else that has to be done within your organization should support that goal. For those of you in leadership positions, we know you're listening to your employees, we know you're listening to policymakers and the scientists. You're learning from that and developing programs to roll this out over time in an organized way. But as you do that, be ready to accept the criticism, controversy, the demonstrations that may be as we speak in front of your buildings. Know that from our point of view, you're doing the right thing. We applaud you, we support you, and we believe that this is the fastest way for us to get past this pandemic. So just thought it was important for you to know our point of view on this before we roll into the rest of the presentation. And building on that, we're going to cover 4 different topic areas as we go through. Get us all on the same page with the chronic issues, things that have been plaguing us for decades, and how those have become even more problematic recently. And we'll talk about some of the factors and challenges. Then I think it's important for us to pivot over and have an understanding of what workers want. What is it that's important to employees? And I think that's only with that deep understanding can we develop campaigns and programs that will help us to recruit, retain, attract, and delight employees. And so we'll finish up with some strategies and ideas as we go through that part of the presentation. And so the methodologies that not only helped inform our trends report, but a lot of the points of view on this, first, this is something we've been doing since 2014. We conduct numerous email surveys of our clients and a lot of their stakeholders on these issues. We do a lot of one-on-one interviews throughout the year with healthcare marketers, many of you that are in attendance, industry thought leaders, leaders of associations, elected officials, American Hospital Association, CDC, American Marketing Association, NESHCO are fabulous sources of content for all of this. We listen to that. We also, through our team and the group that Lisa leads, do a lot of active social listening, and Google Trends is a fabulous tool. All of this, I think, helps inform our points of view that we'll share with you as we go through today. So let's start with the chronic issues and level set, make sure we're all on the same page with really what the fundamental problems are that we were dealing with before we get into the era of sort of mass resignation that we were talking about. So let's roll a news clip. Adam?
The University of Pennsylvania School of Nursing says the U.S. has been dealing with an on-again, off-again nursing shortage since the 1930s, and the length of our current crisis varies from state to state. As recently as 2018, the American Journal of Medical Quality projected Florida would have a shortage of more than 77,000 nurses by 2030. That's the second highest projection in the country, and the demand isn't slowing down. The Federal Bureau of Labor Statistics projects 300,000 new registered nursing positions nationwide by the end of this decade. It's one of the fastest growing job fields. The Bureau also projects nearly 176,000 job openings every year for registered nurses. So how did we get here? The American Association of Colleges of Nursing says a big chunk of the current workforce is nearing retirement age, and nursing school enrollment is not growing fast enough to meet demand. There's also a shortage of people to teach future nurses. And it's critical because we're getting older. A University of Florida study published last year projects 38% of people in the Bay Area will be 55 and older by 2030. Those estimates say more than half of Sarasota, Citrus, and Hernando County's population will be 55 and older at that time.
So we thought it was important to share that in particular, ABC affiliate out of Tampa, because it's one of the states, I think, that not only that we consult clients in, but also because it's one of the states that's facing this challenge, more than others. And I think, as you can see, and we can go back to the PowerPoint, you'll notice the issues that we've had over time preceded my career. I started in the early to mid 90s and kind of learning about some of those challenges. So as you've seen and heard a moment ago, this is something that we've been dealing with since the 30s and acutely and persistent since the 90s. Adding to the reasons that the reporter covered, hospitals are no longer the only option. I think that business model is shifting dramatically. And I think in the coming weeks and years, you'll see CVS, Amazon, Walmart stepping even deeper into that. And I think that's what's challenging a number of the traditional settings for hospitals and freestanding clinics. As you saw, nursing enrollment is down, and I think understanding that from a industry perspective, that having that clearly defined culture is critical. It's something that we as branders and marketers often talk about, but I think it's critical, and you'll hear us talk about this later. Understanding what those points of differentiation are as you build not only your institutional brand, but your employment sub-brand. So from a competitive standpoint, there's been a lot of challenges. I think there's an arms race with people on sign-on and retention bonuses. We're trying to buy our way through this. Competing on price and flexibility has been, sort of top of that. I think that most of us are dealing with the extras programs that either employees are demanding or competitors are offering are essential. And we've got a slide toward the end of the presentation that speaks to some of that and some ideas. For many of our organizations, we've had to focus on recruitment. We need to fill slots. And given the sizes of our staff in HR as well as communications, that's been the focus. We haven't had the resources we need to focus on retention. And as I mentioned before, many organizations are struggling to discover that true point of differentiation. An RN is an RN is an RN. And very often the needs and wants of those employees can be found within your organization, and it is something that is an attractor. I think in many cases it's not something you need to create a point of differentiation, but really just take a self-assessment to understand how your organization creates a better culture. And again, we'll talk about that as we go through in a minute. And then finally, employees have become more demanding. Obviously, they understand that it's sort of a buyer's market or whatever. Creating loyalty is essential, and I think it's important that we shift that debate from merely talking about the jobs that are available and the perks we're going to offer into understanding and messaging to the needs and wants of the employees. And again, we'll talk about that in a little bit more detail as we go through. So those are the chronic issues we've been dealing with. Things certainly have gotten a lot more acute. And let's look at, since COVID, February 2020, the healthcare field of healthcare nationwide is down more than 500,000 jobs, which really just threw gasoline on an already brightly burning fire, frankly. We're seeing most of those jobs in nursing and residential care facilities. They're representing about 80% of those losses. And a Bureau of Labor Statistics report that just came out on the last reporting cycle showed that healthcare lost a net 17,500 jobs in September after losing another 5,000 in August. A lot of those were in hospitals. Most of those were in nursing and residential care facilities, but ambulatory care facilities gained nearly 28,000 jobs. It goes back to my point earlier about hospitals, not the only option. And why is it that those centers are growing? Is it because policies have changed? Perhaps, but more importantly, I think it's the options that employees have that they didn't always in the past.
And also the October jobs report actually comes out tomorrow. So many economists predict that we will continue to be adding jobs, but recent gains have been weak. So the question is, how many jobs will we actually gain? So that's going to be interesting to see.
Yeah, exactly. Thanks, Katie. The overall growth has been slow. And in particular, it's been slower in other fields. So yeah, we'll be tuning in. I think that comes out at 8 o'clock tomorrow morning, so stay tuned. And certainly one of the problems, and this may not be causing the deepest number of losses of jobs, but the vaccination mandates that we've been talking about before. In an attempt to drive up the vaccination rates and protect people nationwide, a number of different institutions, private employers, public universities, hospitals, health systems have adopted either federal recommendations or state recommendations, industry recommendations for those. And that's certainly challenged a lot of us overall. Unfortunately, and as I said before, this issue's gotten political. I think this chart here will show rate of COVID cases by the party affiliation of each state's governor. So to the left, you'll see early on in the pandemic, and many of you will remember New York City being a hotbed for COVID infection rates. New York State Governor Cuomo, then Governor Cuomo, Democratic governor, sort of leading those rates. And so interestingly, though, over time, those issues have shifted. You'll see that the states with Republican governors, the red line, is now growing at a higher rate than states with Democratic governors. completely not necessary, and may speak to, well, look, I mean, obviously, it's not as if Republican governors are hugging, kissing, and coughing on all the people in their states. Clearly there are policy issues at play that are being followed by their constituents, and that's affecting the disparity between, again, both Democratic and Republican, governors. Adam, let's roll the next video clip.
Tonight, growing backlash over President Biden's vaccine mandate. At least 19 Republican governors denouncing the rule, requiring businesses with at least 100 employees to make COVID shots mandatory or offer weekly testing.
The president's actions in a mandate hardens the resistance.
Florida Governor Ron DeSantis promising a fight.
People should not be cast aside because they make a medical decision for themselves.
President Biden calling opposition cavalier, adding all federal workers and contractors should be vaccinated within 75 days or face fines.
The requirements for vaccination are part of a long tradition that we have in this country of taking steps as a collective to keep people safe.
But fallout underway. In New York, the mandate forcing one hospital to turn away expectant mothers after staff members quit.
The number of resignations received leaves us no choice but to pause delivering babies at Lewis County General Hospital.
In North Carolina, business owner Stephen Bullock feels stuck.
It's a fight every day.
The vaccination rate of his 125 employees about 40%. Now he fears some quitting to work somewhere smaller where the mandate doesn't apply.
Have you found anything that is capable of changing someone's mind at this point?
Frankly, I have not. Folks are really dug in, and it seems the harder you try, the further they go.
And yet major corporations in favor. Companies like Amazon, Home Depot, and Walmart say they welcome the plan. The hope, drive down U.S. COVID cases as they start to plateau. Infections now down 10% from their peak during the latest wave driven by the Delta variant.
So we may have turned a corner, but as you can see, the issue's gotten political, and from a recruitment and retention standpoint, it's given rise to things like Walkout Wednesday and a lot of the protests that you've seen. More on Lewis County in a moment. I think we'll take a deeper dive there in a second. So the response to vaccination mandates hasn't been universally positive, though overwhelming. I think the vast majority of institutions and employees have been adopting it. Unfortunately for those folks, history is not on their side. Katie, any guess what year the first vaccination mandate law was enacted in the United States?
I was really surprised to find out that it was actually in the 1800s. Is that right?
Yes, 1809, and it will return to the slide, 1809 for smallpox, and that was actually enacted in the state of Massachusetts. I was frankly surprised to learn that myself. Many of you were probably guessing sometime in perhaps the 30s, 40s, 50s. So 1809, Massachusetts, smallpox vaccination mandates. So what happened? A little less than 100 years later, that issue met with resistance at the time, though not as widespread as it is now, rolled up to the Supreme Court. Very famous case, Jacobson versus Massachusetts. And there the Supreme Court upheld Cambridge city law, Cambridge, Massachusetts, which required the vaccination, saying that yes, while people do have personal rights, they don't have a right to place other people at risk, and that is the core issue. Frankly, we see that as the sentiment being the core issue for healthcare workers. We pursued careers in healthcare to serve people who are vulnerable and suffering. That confidence and trust, knowing that I could go to my healthcare provider for treatment of whatever, my situation is. I don't want to be worrying that I can be further infected by something like COVID. And we believe that, of course, the vaccination helps to do that. So surprisingly, thousands of healthcare workers are walking off the job. So let's look at the clip from Lewis County, upstate New York. Adam?
In the small town of Lowville in New York's North Country, women will soon have to go up to 50 miles away to give birth after 42 healthcare workers resigned over the state's vaccine mandate, and another 120 have still not complied.
At the end of business on the 27th, if you are not vaccinated,
unfortunately, you can't work here anymore.
Already faced with a staffing shortage, the hospital is pausing its maternity services after next week and reevaluating other departments.
What does that tell you about vaccine mandates?
It works. We went from 63% in mid-August when the mandate was first announced. And now, about 4 weeks later, we are at 81%.
So the good news is the vaccination rates within that hospital and many hospitals after the mandates rose dramatically, which is great, but you can imagine the long-term damage that's being done to the brand. So as we kind of move on past that sort of political portion of our presentation, I think it was important to acknowledge not only the chronic issues that we've been facing, but also even the more acute issues and perceive the damage done to the brand. I think, as a viewer of that news clip in upstate New York, you might take comfort knowing that, okay, the vaccination mandate is working, and yet, frankly, the headline is, I can't get the services I might need right in my own hometown. That has repercussions far beyond just this topic at hand. Many of you that tune into our webinars over time will hear us say that those key drivers of patient perception of quality within your institution are cancer, cardiac, and obstetrics. How your organization performs for those and what the reputation is within those three service lines tends to paint the picture for the institution overall, that rising tide lifting all boats sentiment. And so with that in mind, knowing that the consumer confidence is the bedrock of your brand, we think it's important to work past this issue. Hospital system on Long Island in New York, just east of Manhattan, was the first site nationwide for vaccination. Nurse Sandra Lindsay was the first person to receive it back December 2020. But their CEO basically going out and saying, we would have assumed that this was, something that our staff would do, and 98% of our staff did that, but we didn't want to terminate folks. We didn't terminate folks. They just simply didn't agree with those policies. So again, I think we applaud and support the leadership, encouraging them to stay the course as they kind of go through. So let's pivot to what the workforce wants. What is it that they want historically, and what is it that they want now from their healthcare provider? Well, in addition to the vaccination mandates, other reasons that we've learned and surveyed and spoken to our clients about, first, burnout during COVID. In addition to the vaccine mandates, the stress that was placed on healthcare workers across the board was incredible. In addition to that, though, of the people that retained their jobs during COVID, 19% of them also said, I'm considering leaving the profession overall. And this was a recent, we'll have the site sources at the end in the shared presentation. In general, chronically and more acutely, they're overworked, they're task-focused. There's been a chronic issue of pay scale, lower than market pay scale, but that might be changing. I think you'll hear in a clip coming up in a moment about some of the changes within the industry. I think they're recognizing the importance of these positions and trying to fund it appropriately. As we've been focusing on recruitment and offering incentives and bonuses, that creates some inequality between newer and older employees with regard to pay scale. But very often they just want to know that they're heard. They want to know that they're making a difference in their profession, but that the leadership understands their needs, that there is meaningful communication and a dialogue, with them. Thankfully, I think most of our clients and many of you watching have leadership representation from HR, at your president's cabinet. If not, you should. And frankly, there's a bit of sort of over-survey, that takes place, learning that they still don't feel necessarily appreciated. The issues that we've seen for prospective employees, I think in the order of preference, long-term growth and benefits, and this is an area I think where hospitals have a competitive advantage over other smaller organizations, these smaller pop-up clinics and more retail medicine settings. I don't believe will offer people the opportunity like this nurse in Tacoma who retired at the age of 96 after a 70-year career. I think that's our holy grail, and certainly what we strive for. And that's a point of competitive advantage that I think hospitals and health systems do have. If you've reached a plateau within a particular service line, there are other places within the organization that you could perhaps continue to grow. So that ability for long-term growth and benefits, I think, is critical. Flexible schedules, work-life balance, I think, is essential. A positive, friendly, pleasant internal culture. independent or the ability to make decisions. Pay and benefits obviously are important. And overall, I think, and you'll hear us say this throughout the rest of the presentation, that caregiving role and intrinsic satisfaction of their job, how they feel at the end of the day, and the joy that it brings them, that sense of accomplishment, rewarding, making a difference in a culture that appreciates them, really overpowers those pay benefit concerns. And I think that's what's going to help your organization foster a deeper sense of loyalty over time. So what are some of the strategies, tips, tactics that we can share to help your organization as you're moving forward? Well, first, thinking about employment as a sub-brand and approaching that the same way you would any other service line. I think it's very easy for us as marketers to say, okay, we want to go out with a bariatrics campaign, we want to go out with orthopedics, whatever the topic could be. But thinking about employment with that same point of view, it's more than just advertising for jobs. And finding that true point of differentiation. Loved this campaign for Ellis Medicine in upstate New York, become an Ellis nurse. And the rest of the campaign really paid off that headline to really speak to why that culture. It's not just that you're a nurse as a nurse, and if you could do it there, come over here, but really what is it about, that, and a sense of pride. And even what I loved about this was that identity, that, I am an Ellis nurse, for example. So there's an opportunity, I think, to build that brand while you're advertising career opportunities. If your external message speaks to we only hire quality employees, well, that's synonymous now with your brand, and that's a message the public is going to apply beyond just the job postings, but really consider as part of the overall campaign. As I mentioned before, get HR and marketing to the table. They have shared interests, and I think it's also important to share resources. Very often, and I hope our boss isn't watching this, but we've made recommendations that we divert dollars out of marketing and advertising and put those into HR and internal programs because, frankly, that's where they'll do more good than sometimes, advertising campaigns. Doesn't mean that we're not going to be promoting the culture, promoting the brand, promoting opportunity. But I think very often, especially with regard to retention programs, it's important to share some of those budgets and resources and bring your organization's reputation as an employer up to the level you enjoy for medical excellence. And humanize those campaigns. Real people, no stock photos, human stories. This is what you'll hear about over the next couple slides. Make it about the people, because people who need people, the rest. So one of the trend number one, in fact, of this year's report was addressing burnout head on. And I think that's one of the other things we wanted to highlight, and speak to. I think there's a number of systemic failures that are happening within organizations, workflows, technologies, those bureaucratic tasks. Those are things that I think are important to peel away those layers of the onion. Listening to the employee surveys, shadowing employees, learning about what it is about their day that could be automated, that could be redesigned and restructured, within. I think those are things that are harder to change, but have a much more dramatic impact. Frankly, saying that you're changing those, creating a workforce to make things less task repetitive, building out smarter, better workflows is an important message to send externally. I'm not saying you don't have to solve the problem someday, but I sure would like to work with an organization that acknowledges it and is doing something tangible to direct it. Engaging staff to listen. A few of our clients have CEO hotlines, which I think is fabulous. A direct line to the CEO, and if he or she are not available, leaving messages that get responded. Just that sort of comment box that we used to see. I mentioned briefly a moment ago about technology audits. I think many of these positions can be automated. A lot of your enterprise systems do allow that to be done. So the more that could be on the go with iPads, replacing, the workstations that are more desk, driven. And really one of the things, and I think Lisa was the author of this in the Trends report, were those self-care programs and benefits. Things that highlight employee wellness, whether it's discounts to yoga classes, whether it's, subscriptions to relaxation apps like Calm, things like that that could acknowledge that we understand the stress that you're under. We want to help be part of the solution. They don't have to be necessarily expensive, but having everything from those meditation rooms to discounts for relaxation apps and things I think would be critical if you're not already doing them, and important to be promoting externally as well.
Just to add on to that, Paul, another cool thing that I've read about is hospitals implementing peer-to-peer coaching, where employees have a specific person that they can go to if they're feeling particularly stressed, just to talk it through, or also having an anonymous online system where people can submit feedback or concerns, because not everyone's going to feel comfortable actually going to someone face-to-face, so having an anonymous option is really nice too.
Yeah, and that all speaks to that culture of listening, caring, camaraderie, throughout. One thing I mentioned before as we were talking about the sort of arms race, as people are trying to buy their way into sign-on and retention bonuses and offering perks, many are or aren't doing some of these things, but some of the time saver perk packages that we've seen a lot of our clients implement, options on site for daycare or even elder care, things that'll save you time and transactions, dry cleaning services that are drop-off pickup at hospitals, are the kind of things that are almost effortless to implement, and again, sends a message that we know your time is important, and if you're not here, we want you to, enjoy your time with your family and your recreation as much as possible. Bagels for new hires, we do that a lot ourselves. Free coffee. If you have a coffee club for 25 cents, please do away with that as quickly as possible. Discounts to housekeeping services. There are companies within your communities that offer these, and I'm sure that they would love to have you as a conduit to help promote their services in exchange for discounts. Car maintenance services, really interesting, more in suburban and rural settings, but companies that go and also that offer to do oil changes right in your parking lot. Take-home dinners that your cafeterias can have, sort of grab and go. I think most of you have these. And even any type of discounts and coupons for food establishments, for movie theaters, performing arts theaters in your community, all go a long way to letting people know you care about that work-life balance. You want to try to be part of that solution.
Yeah, Paul, just backing up, I think this slide is so important, and it seems like such small things that you can do, but I do think it really makes a difference. And especially now that we're seeing travel nursing becoming so popular, because there's such a high demand for it, people are leaving their hospital jobs in favor of travel because they can make so much more money. So I think you really have to give people the incentive to either stay, or attracting people who might be trying to choose between the two, really highlighting and being upfront about the things that you offer that they wouldn't get if they were traveling.
Yeah, exactly. And we've heard, you'll see in a brief clip in a moment, but we've heard from a number of staff that have per diem nurses, staff that have transferred from full-time to almost per diem status. Now they have the work-life balance, they can determine the schedule that they want, and the pay scale, frankly, is, doesn't mean that they have to take a significant, cut in pay in order to have that work-life balance that they want. In fact, that probably should have been one of the challenges, I think, to Katie's point, the rise of that, sometimes it's part of the solution, sometimes it's also, part of the challenge for that full-time retention. Also, going to that building of a internal culture of caring, I think from a public relations standpoint, there are so many great stories. To my Barbara Streisand moment a few slides ago, the more you can tell human stories about your organization, celebrate those achievements, not necessarily just work milestones, but what are the things that your employees are doing? Ran their first marathon or their first couch to 5K, weight loss journeys, had their first child. Any of those milestones that are just very warm and endearing moments that we all like to see on social media are things that, with their permission, that you can be sharing and speaks to the humanity that is your organization. I think expert positioning, getting those thought leaders within your organization out into the community, they're typically smart, confident, likable faces within the organization that really help to underscore not only your expertise, but also builds that sort of campaign brand. And then merchandising that wherever possible. If there's something that happens in the news, sharing that in your newsletters or your in-hospital signage or on your TV monitors throughout. Essential. Katie mentioned these sort of mentorship and buddy systems for new employees. I think that helps people guide and join within a new organization. And I think she even alluded to career counselors, folks that can kind of give you a sense of where that path is. Those are things you're not going to find in other non-traditional settings. Recognition programs, I think a lot of us are doing that for certifications or milestones. And a lot of us are doing scholarship programs. And one thing I liked in particular, I think if you can go beyond just writing a check, if you can, speak to not only, yes, we want to encourage you to grow within our organization, we'll help support the cost of your academic growth. Let's look at this clip and revisit that again in a moment.
Nurses who strike a deal to work at Johnson Memorial Health benefit from this annual bowl-a-thon created by the hospital to raise money to help nurses with an associate's degree get their bachelor's degree.
Going from your associates to your bachelor's can cost anywhere between $12,000 and $15,000 or even more. So any little bit helps.
So the medicine's in. Brent Shepard is a RN in cardiology. Compared to 4 years ago, he says 80% of his fellow nurses at the hospital now have their bachelor's degree. He's among those who took advantage of the scholarship fund, earning his bachelor's.
So having this available encouraged me to go back, because I was thinking, man, do I really want to do this? But it helped me push it. And then once I got it, it's like, you know what? I want more people to have this.
Studies show without a doubt that the higher level of skill that nurses have, the less medical errors, the better care that's received.
JMH, like its counterparts, is looking for ways to keep their nurses and hire more. The Homegrown Scholarship Program, funded through this bowling event, is one way to address that critical need. Desiree Shadley was a mom before becoming a nurse. She was surprised initially to learn that the staff held this type of fundraiser to help other nurses finish their 4-year degree.
But I believe that is encouraging us to want to go back, but also it makes you want to be a part of it. I want to be a part of helping others, not just receiving, but also giving.
She applied for assistance and earned her bachelor's degree. This year's event had a movie theme, Among the Minions, a cross-section of costume characters for an event that will continue while an incredible need for nurses has hospital administrators on pins and needles over staffing.
Pins and needles. Love the pun at the end. What I love about that when we first learned about it was, I think this speaks to one of the core needs that people or that employees have said that they want, which is that ability for long-term growth. If the institution's going to make investments in their career growth or academic growth, that's fabulous. And I think a lot of institutions do that. What I loved about this was the layers of positive messages. Wouldn't you want to work for an organization whose employees all come together to help me grow within the organization and succeed? The message to somebody from the outside about that internal culture is fabulous. That sense of people coming together, supporting each other, and I think, as the one nurse mentioned at the end of the clip, it sends a message of caring that just has a level of sincerity beyond just that sort of patient interaction. Absolutely loved this, was really, really eager to share, I think, that as a good example of all of what we were talking about in action, understanding the employee's needs and wants, looking at ways that other employees can sort of demonstrate and live that, rather than just simply, to our point on the slide here, writing a check and throwing money at a problem. Do that, and if the news clip would be going from an A to an A+, I would say I would have loved to have learned perhaps that the hospital or health system was doing a matching program. Whatever was raised today was going to be doubled because of the match from the parent institution. That would also send a deeper message about the institution's dedication and commitment to this program as well. So wanted to share that with you as we went through. And a couple other just miscellaneous recruitment ideas as we sort of wrap up in a moment. Back to work program for returning employees. How can you get folks that are either retired to come back, for a few shifts, or maybe have taken time off to support their families, but really developing a formal program. How can we get you re-engaged in the workforce, relicensed, or get your certifications and credentials current, and help you make that step back? Maybe it's even transitional. Do I feel like if I've been with my kids for a number of years, I got to drop all that and be in for, some shifts that are still going to be pretty demanding. Maybe there are transitional schedules and things like that that could be part of a back to work program. And tactically, one thought, and something we've seen a lot of our clients succeed with, is looking at the lists you have and revisiting those applicant lists. Because somebody may not have been a perfect fit for a position, a month or two ago, I think reaching out to those folks again and letting them know about the current openings, may cross-sell and help them find the right fit within your organization. They certainly wanted to work, but maybe that one position wasn't a good fit. Don't feel like you've got to start fresh and keep adding, new names to new postings and those responses, but look at the list you've got and consider reaching back out to those, for new and different opportunities. And so a parting thought as we're wrapping up here, and I think this captures the sentiment of everything we're talking about today. It's a quote from Patch Adams, and I didn't realize that there was a real Patch Adams. But saying, you treat a disease, you win, you lose. You treat a person, I guarantee you win, no matter the outcome. And I think that's true, certainly could be said, from us to the patients that we care for, but more importantly, I think, how we want to treat and think about our employees and workforce internally, I think is captured in this thought as well. So thank you to everybody that's tuned in on all these different platforms. Thank you for bearing with us during, and all of us going through what is a very political time, aggravating the problem of recruitment and retention. And hopefully you found some of these tips and strategies and tactics that we've shared to be of value. Couple other upcoming events. The next Trends Report webinar that we're doing is December 14th, and that's on creating first-party data. Many of us rely on, and I think if you're a subscriber to Lisa's newsletter, you'll see recently she was talking about this over-reliance we have on social media for access to audiences. And as she goes to say, it's really just us renting these relationships. How can we create that first-party data within our organization? It goes deeper than just a contact form. And really excited that we're announcing right now the release of our second edition of Under the Influence. Smith & Jones publication, originally released about 4 years ago, has been updated with a lot of new content, and in particular topics that I think are even more acutely relevant during and post-pandemic, that have been our anthology of healthcare marketing best practices, and something that had been pretty popular. So stay tuned, we're going to be promoting those over time, and that will launch with a webinar on January 20th. So on behalf of all of us, Katie, live with me here in the studio, and Lisa watching perhaps live, thank you. We hope you found this presentation to be of value, and if we can help further, please let us know. We'd love to be a resource and know what's keeping you up at night. So thanks for joining us, and we hope to see you again soon.
Thank you.